Hey guys, how is your NClex review going? Today we're going to quickly go over anticonvulsants. Again, I'm very sorry if you do hear noises and yelling in the background. There's actually people and children all around me, so I'm very sorry for that. So, today we're going to talk about anticonvulsants, which is mainly used for seizures and epilepsy, hence the reason why it's usually called an anti-epileptic drug or an anti-seizure drug, right? Basically what it does is it inhibits seizure activity, okay? Now, it can also be used as a mood stabilizer, right? So therefore, it can also be used for treating bipolar disorders and other personality disorders. And also, let's quickly go over how anticonvulsants work. Basically, the mechanism works by blocking the sodium channels or the calcium channels, or on the opposite spectrum of that, it can enhance the GABA receptor, which is basically an inhibitory neurotransmitter. And obviously, our main goal is to reduce excitability in the central nervous system or in the CNS, which will hopefully reduce and calm down any muscle spasms, right? The patient has. Now, I'm going to go over three categories. These are the main categories that you will most likely encounter in the NCLEX exam. Obviously, there are other categories of anticonvulsants, but I believe these are the main three that you will most likely encounter. Now, we're going to go over barbiturates, which is usually used for tonic-clonic seizures, benzodiazepines, which is used as a CNS depressant, and hydantoins, which is mostly used for status epilepticus. Now, with barbiturates, phenobarbital, which is Lumina, and primidone, which is Mysoline, are the most common medications that you will most likely encounter in your NCLEX exam. And barbiturates are actually one of the most effective and widely used anticonvulsant. Okay. Now, side effects can include dizziness and drowsiness, and we do need to watch out for hypotension in our patients, right? Since it's a CNS depressant, right, and respiratory depression. Those are very important. Next are benzodiazepines, and the two most commonly used drugs are clonazepam or clonopine and diazepam, which is Valium. Now the thing with Valium is it's given IV push only, therefore we don't give it as an infusion. Okay, you have to be careful about that. And side effects for both these drugs would include ataxia, which is basically just an impaired balance or impaired coordination, right, in the patient. The main issue that we have, again, guys, I'm very sorry for the noise in the background. Now, the main problem that we have is drug dependency, okay? So therefore, we need to, it's basically tolerance problem, right? So we do need to have patient teaching and proper guidelines, right? To, to teach our patient and telling them the harmful effects of dependency of benzodiazepines. And it as well can cause cardiovascular depression and drowsiness, okay? Now, I'm just going to go fairly quickly with hydantoins. Now, hydantoin, uh, major drug is phenytoin, which is Dilantin, and it's a very major anti-seizure drug medication. And I believe that this is a very important drug. You might most likely encounter this drug in your NCLEX exam, so be very aware about that. Usually used for tonic-clonic or partial seizures, and it can be given PO or IV. Okay, now with IV intravenously, once it's given 30 minutes, it works 30 minutes after being administered through IV, and it's effective for 24 hours. Okay, and the thing with phenytoin is we do need to check the blood levels, right, in order to measure the proper dosage. Okay, now again, I'm just gonna go over fairly quickly. This is it for now. I'm gonna go over other similar drugs on the next video. So I'm just gonna have this fairly quickly. Again, thank you so much, guys. I really appreciate you guys stopping by, and I hope I can do more and give you guys more value. I really do appreciate that, and hopefully you have a great day and God bless. Thank you so much. I appreciate it. Bye bye. Now, with Parkinson's disease, it mainly affects the nerve cells in the brain, specifically the nerve cells that produces dopamine. Okay, now we call Parkinson's disease a progressive disorder of the nervous system, and it mostly affects the movement, right? Therefore, our main symptoms would be related to our patient's movement, such as muscle rigidity. There would be tremors, right? There would be some changes in speech, which is what we call aphasia, right? And also it affects the gait or walking with our patient. Okay, now remember that after diagnosis, right, the treatments for our patient can help relieve the symptoms, but there is no cure for Parkinson's disease. Again, after we diagnose our patient, our treatment can help alleviate the symptoms, but there's no cure for our patient. Now, there are mainly two general approaches, right, to treating our patient with Parkinson's disease in regards with, I'm talking about medication, in regards with pharmacological interventions, okay? Now, the first approach is to attempt the increase of the levels of dopamine within the brain. So our first approach in treating our patient would be the increase of levels, right, with dopamine in the brain. And another approach, the second approach, is to improve the symptoms, right? Help alleviate the symptoms of our patient. Now, I want to talk about one of the most common drugs that we use to treat our patient with Parkinson's, and that is Sinemet, right? Sinemet is basically made up of two drugs, which is levodopa and another drug called carbidopa. That is why Sinemet is sometimes called levodopa carbidopa, okay? Now, levodopa. With levodopa, it basically enters the brain and is converted to dopamine. And how this is done is basically levodopa is transported to the nerve cells within the brain that produces dopamine, and it is then converted into dopamine for the nerve cells to use as a neurotransmitter. Okay? So again, basically, levodopa enters the brain and is converted to dopamine, therefore increasing the dopamine levels of our patient, right? Now, with carbidopa, right, the other drug carbidopa, with carbidopa, it increases the effectiveness and prevents or lessens many of the side effects of the levodopa, such as nausea and vomiting, right? And there could also be occasional heart rhythm disturbances. And how this works is that with carbidopa, it prevents levodopa from being broken down before it reaches into the brain. And because of this, it allows for a lower dose of levodopa, which causes less symptoms such as the nausea and vomiting, right? Now, again, just so that you can understand more clearly, I'm going to explain it more simply. Levodopa is transported to the nerve cells in the brain that produces dopamine, right? It is then converted into dopamine for the nerve cells to use it as a neurotransmitter. And as a result, it helps increase the dopamine levels of our patient. Now, with carbidopa, it actually has two benefits. Now, with carbidopa, it is usually given to a patient in order to help inhibit peripheral metabolism of the levodopa, right? So first, it aids for our levodopa to cross the blood-brain barrier within our patient for a greater CNS effect, for a greater central nervous system effect, right? And second, it works by preventing levodopa from being broken down before it reaches the brain, which causes less symptoms of the nausea and vomiting, which is a symptom that our patient with levodopa would have, okay? Now, as the nurse, you have to teach your patient taking Sinemet that it is recommended that they take it on an empty stomach at least 30 minutes before or 1 hour after review. Now, I want to go over antiparkinsonian medications, okay? Now, specifically, I want to go over benztropine or cogentin, okay? And we'll also go over levodopa, which is an important medication for our patient with Parkinson's disease. Okay, now first let's look at our patient with Parkinson's disease. So what is Parkinson's disease? Now we all know it's a progressive neurological disorder, right? And specifically what's going on is there's a destruction within the nerve cells, specifically within the basal ganglia, okay? And what we want to look at and take note is that there's a couple of neurotransmitters that are really being affected. So please make sure to take note of this. And what occurs is that basically there's a decrease in the dopamine levels and an increase in acetylcholine. Okay, now these are neurotransmitters, right? Again, there would be a decrease in dopamine and an increase in acetylcholine. And with Parkinson's disease, as we all know, it affects the nervous system, specifically more in the autonomic part of the nervous system, and eventually affects the movement in our patient. And this is manifested through major symptoms, right, as we all know, of our patient having Parkinson's disease, such as tremors, right, which is basically like shaking. It usually begins with the limbs and eventually affects the major parts of the body. Another big one is bradykinesia. Okay, now bradykinesia is just a term used for slow movement. Okay, so it basically means slow movement, and with the patient with Parkinson's disease, over time it reduces their ability to move and kind of restricts the movement in our patient. Okay. Another big one is aphasia or aphasic, right? Or speech slurring and speech changes. And what happens is that basically there's a loss of the autonomic function in the lingual muscles and also the tongue, and eventually affecting the way our patient talk. And lastly, there's rigidity or rigid muscles, right? Basically the muscle kind of stiffens, and this is important because it kind of limits the person's range of motion, okay? So our main goal for a patient with Parkinson's disease in regards with medication, okay, is basically to reverse the effect of the neurotransmitter, specifically dopamine and acetylcholine, which results in these symptomatic symptoms, right? Therefore, we use what we call anti-Parkinsonian medications, right? We call it anti-Parkinsonian medications because it basically reverses the effect of these neurotransmitters. So what we're doing is we're treating the symptoms, right? Because there's no cure for Parkinson's disease. So when treating our patient with Parkinson's disease, we usually look at three what we call anti-Parkinsonian medications, right? And that would include benztropine or cogentin, levodopa, and the last one would be a combination drug called carbidopa-levodopa or Senimid, okay? Now first let's take a look at benztropine or cogentin. So going back to our patient with Parkinson's, remember that I mentioned that our patient with Parkinson's has an increase, right, in the neurotransmitter acetylcholine. Okay. Now, what benztropine does is that it's basically an anticholinergic, right? Obviously, so it reverses this increase. And the pharmacological term would actually be called acetylcholine receptor antagonist, okay? So that's just a fancy term. And what it does is it basically blocks the cholinergic activity within the basal ganglia. And this decreases, obviously, the neurotransmitter acetylcholine, which will eventually help improve the symptoms of the Parkinson's disease, specifically in our patient, which is manifested physically as tremors, right? So what this drug basically does is it helps with the tremors with our patient with Parkinson's disease by blocking the cholinergic activity, therefore decreasing the acetylcholine levels in the brain. Now, let's go ahead and take a look at the next primary medication, which is levodopa. Now, sometimes it's also called L-DOPA for short, right? So don't get confused. And basically, what levodopa is used for is it basically increases the dopamine concentration in our patient with Parkinson's. Now, remember the two important neurotransmitters that are affected with our patient with Parkinson's, right? Basically, there was an increase, right? An increase in acetylcholine, and there is a decrease in dopamine, right? Now, guys, dopamine is important because it's a neurotransmitter that helps and allows our brains and neurons to facilitate and control motor activity in the body. And obviously, a loss or decrease in dopamine can be manifested through the Parkinsonian symptoms in our patient, which we all remembered, right? So basically, what happens inside the body is that the levodopa is converted into dopamine from within the peripheral nervous system, and as a result, increases our patient's dopamine levels, okay? So this is it for now, guys.